The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul, and today I have Dr. Jared Chapman of Living Well joining us. Dr. Chapman, how are you?
I'm living well.
Well, it's great to see you as always. And today we're going to discuss a skin condition that affects a lot of people out there, and that is acne. But you've
Mhm.
got some ways that you can treat that and give people relief.
So, we're very excited to talk about acne. It is one of the most common complaints out there for a family practice, internal
Mhm.
medicine, dermatologists. I mean, this is the most common and prominent skin condition that brings people to the doctor is severe acne outbreak or acne scarring or acne hyperpigmentation. And we have brought some new things on here at Living Well that actually addresses these concerns in our adults, 21 and older. So that's who we're focusing on today, are people who are still consistently having acne outbreaks after becoming an adult, or maybe their acne outbreaks cleared up and then they started to go through menopause, as our women
Mhm.
do, and then they noticed the hormonal acne starting to activate and come out. First of all, let's talk about skincare. We have a new product line from Skin Medica. We have a foaming wash that actually helps to purify the skin. It has salicylic acid in it that's encapsulated, which really helps to clean out the pores, and it helps to really calm down the bacterial overgrowth on the skin. We also have an acne serum that now has very good anti-inflammatory properties in it and also reverses that hyperpigmentation that we see on the skin in our adults from that adult acne. So patients who are suffering from that red or purplish scarring that they see on their face from having acne outbreaks, or our African Americans who get that darker
Mhm.
hyperpigmentation around the
Mhm.
outbreak, this product actually begins to reverse that when in just a very short period of time, within actually 2 weeks, we start to see this hyperpigmentation start to fade. That is one
Wow.
of the things we are most excited about because that's what we see most people suffering from. So the topical is that it will help lower outbreaks and it will also help with hyperpigmentation. Second thing is we have brought in the VI peels. The VI peels are awesome for treating the skin and all of its different problems that it has. VI peels are self neutralizing, meaning we apply them to the patient and then the patient is allowed to leave the office with the peel on their face. There is zero pain with with these types of peels, and they address multiple skin conditions from hyperpigmentation to fine lines and wrinkles, to rosacea, to melasma. So we see a wide use of these pills, but definitely will address acne outbreak because it will really help to clean that dead skin off the surface. They are from least aggressive to most aggressive, meaning some of the Vibe peels you don't see much peeling with, but you do get an enzymatic treatment of the skin. Whereas we have some that are highly aggressive, meaning they will cause the patient to peel maybe even once or twice, but literally with no pain or downtime. What we've discovered with these peels is that there's a little bit of itching with them, and that's why you're supplied with a hydrocortisone cream that will actually keep the itching down as the process takes place. But a very benign chemical peel that gives you an awesome result. And when we talk about peels, there are superficial or epidermal, medium depth, and deep. These are medium depth peels, so they actually get into that dermal layer and really work to repair and rejuvenate the skin. The last thing I'm going to talk about just really quick is our IPL treatment for acne. It is one of the gold standards. IPL is intermittent pulse light. Basically, you're treating again the bacterial load on the skin, plus you're helping to remodel scarring by stimulating collagen and elastin in the tissue. So those have little to no downtime. We can do a series of treatments and someone has acute outbreak to bring that back under control, and then a maintenance treatment with the IPL. We have so many good treatments for acne now, for adult acne in this
Right.
practice. And so anyone out there who is suffering from this should call the office and get a free consultation. Just let us look at the skin and see if we can help, because truly through these modalities we can. And most of them are, when I say less expensive, they're very affordable for most patients out there. Obviously, insurance doesn't cover this, but I mean, they are very affordable. And the skincare that we have is actually a 3 month supply. So,
Yeah.
for less than, I think it's around $250, they get a 3 month supply of skincare that's really going to make a difference in that hyperpigmentation of their skin. That is one of the things I'm most excited about, because that is one of the things that I feel like affects mainly women, some men, but it really affects women when they get those scars on their face from the acne, and they feel like there's nothing they can do. And so I love it when they come in and they're like, I cannot believe how this is faded, and I don't even have to wear my makeup anymore. So
Yeah, that's got to be very satisfying for you to
yes,
hear. So,
we're very excited for it.
and
So
then, like you said, they may reap some other benefits as well, like the anti-aging for fine
correct.
line and wrinkles. And yeah, all right.
Absolutely. It all works together.
All right. Well, Dr. Chapman, thank you so much for being with us. We appreciate the information.
Thank you for having me.